Is a familiar nightmare about to revisit the globe? A former top official from the CDC, someone who has seen the terrifying face of Ebola up close, is now delivering a stark warning. Things are going to get significantly worse before they have any hope of getting better. Before we dive into this critical update, if you want to stay on top of everything happening in US politics and understand the global implications of major events, hit that subscribe button right now and leave a like. It really helps this channel grow and allows us to bring you more in-depth analysis. Dr. Neil Vora, an epidemiologist with direct experience managing a past Ebola outbreak in the Congo back in 2019, is speaking out about the current surge of the virus in several African countries. He didn't mince words when he described the situation to News Nation's Elizabeth. He called this latest spread a very serious situation, and his assessment, coming from someone with his expertise, carries immense weight. He's not just talking about a localized issue, he's talking about a developing crisis that has the potential to escalate. This isn't theoretical for Dr. Vora. He's lived through the chaos, the fear, and the monumental effort it takes to contain a virus like Ebola. His experience means he understands the patterns, the challenges, and the critical window of opportunity for intervention. When he says it will get worse before it gets better, he's likely drawing on a deep understanding of the dynamics of disease transmission, the logistical hurdles in affected regions, and potentially, the speed at which current containment efforts are lagging. What does this mean for us? Firstly, it underscores the persistent threat of infectious diseases in our increasingly interconnected world. What happens in one part of the globe can, and often does, have ripple effects that reach our shores, whether through travel, trade, or the strain on international resources. The CDC, an agency central to U.S. public health and global disease surveillance, is undoubtedly monitoring this situation closely. Their expertise, informed by individuals like Dr. Vora, is our frontline defense. The implications are vast. A worsening Ebola outbreak could destabilize already fragile regions, diverting critical resources and attention from other pressing issues. It could lead to increased travel advisories, impact global supply chains, and necessitate a significant international response, potentially involving military or humanitarian aid. For those living in the affected countries, the situation is, of course, dire, with immediate threats to life and health, and the potential for economic and social disruption. Dr. Vora's warning suggests that current measures, whatever they may be, are not yet sufficient to curb the spread. This could be due to a number of factors: challenges in reaching remote populations, insufficient public health infrastructure, the nature of the virus itself, or even issues of public trust and cooperation. Understanding these underlying factors is crucial if we are to move beyond a cycle of outbreaks and toward effective, long-term solutions. The fact that a former CDC epidemiologist is raising this alarm publicly signifies the severity of the situation and likely reflects a concern that the public, and perhaps even policymakers, need to be fully aware of the potential trajectory. It's a call to attention, urging us not to become complacent. We saw during the COVID-19 pandemic how quickly a virus can spread and how devastating its impact can be when containment efforts are not robust and timely. Dr. Vora's perspective from the 2019 Congo outbreak is particularly relevant. That outbreak was one of the deadliest and most complex in history, highlighting the immense challenges of combating Ebola in densely populated areas with ongoing conflict. His direct involvement means he has an intimate understanding of the operational, social, and political complexities involved in controlling such a disease. What are the possible outcomes if the situation continues to worsen? Without effective containment, the virus could spread to more regions, increasing the number of cases and fatalities. This would put a tremendous strain on global health systems, requiring a coordinated international effort to provide aid, medical supplies, and personnel. There's also the potential for the emergence of new variants, though this is a more speculative concern. Conversely, if containment efforts are ramped up, with increased funding, improved access to affected communities, and strong international cooperation, it is possible to bring the outbreak under control. However, Dr. Vora's projection suggests that we are not yet at that turning point. He's essentially signaling that we need to brace ourselves for a difficult period ahead, and that the current trajectory is concerning. This situation serves as a potent reminder of the ongoing need for investment in public health infrastructure, disease surveillance, and rapid response capabilities, both domestically and internationally. It's also a testament to the vital work of organizations like the CDC and the individuals who dedicate their careers to protecting us from these threats. So, what do you think about this warning from a former CDC expert? Do you believe the international community is prepared for a potentially worsening Ebola outbreak? Drop your opinion in the comments below. I read every single one. The world is watching. Let's hope that with swift action and global cooperation, Dr. Vora's prediction of things getting worse before they get better can be mitigated, and that effective solutions are found before this situation escalates further.